Hello and welcome to COVID-19 Frontline on CGTN. I'm Jiao Yang in Beijing. This is a special program in which we invite doctors from China and around the world to come on our show and share their experience and their knowledge from the front lines of this pandemic. Today, we have some very special guests who I'll introduce to you later, but just to remind you that we are live streaming on our various CGTN platforms. So you can go on our mobile app, on our CGTN website, Twitter, Facebook, YouTube, and Sina Weibo. And if you do want to join in the discussion, if you have a question for our guest, then please do go ahead, leave your question. Just remember to use the hashtag #MyOpinionOnCovid-19. So our topic today is actually very niche and very interesting. So we're very pleased to have these guests with us. It's on traditional Chinese medicine and its use in treating COVID-19 patients. So let me introduce doctors today. From China, we have Dr. Fang Bangjiang, who's the director of the emergency department of Longhua Hospital that's affiliated to Shanghai University of Traditional Chinese Medicine. Now, just something interesting about Dr. Fang, he actually headed up a team of doctors to Wuhan, which, as you know, is the center of China's outbreak, and he led a unit at Leishenshan Hospital that was one of the designated hospitals to treat COVID-19 patients. So there's some very valuable experiences that he'll be sharing with us. 方教授，非常感谢您参与我们的节目。And also from France, we have Dr. Thomas Tatuli, who is chief of the TCM department there at Centre Hospitalier à Leishenshan. And very welcome to our show. From Italy, we have Dr. Laura Ciminelli, Dean of the Villa Giada Institution of TCM. And last but not least, from Brazil, we have Dr. Reginaldo Filho, President of the Brazilian School of Chinese Medicine. Thank you all so much for joining us. Now, we know that we have some presentations from Dr. Fang and from Dr. Tatuli. So why don't we start with Dr. Fang? 方教授，您有一个 PPT 要和我们分享一下。
好，可以了吧？
哎，您可以开始。
好 ，OK， 点这个地方共享。从头开始。大家好，我是来自上海中医药大学附属龙华医院的方邦江教授，也是这次到武汉雷神山医院感染3科5病区的主任。刚才主持人讲了，我的祖籍是中国湖北人，所以在去湖北之前，我就参加了湖北的一些治疗新冠病毒的一些治疗方案的一些指导临床工作，所以到雷神山医院去了以后，所以我能很快的把我自己的经验运用到武汉的新冠病毒肺炎的治疗当中。
Good evening, everybody, and also good morning and good afternoon. Let me introduce you myself. I am Fang Bangjiang from the affiliated hospital of Longhua Hospital from the Shanghai TCM University, and I am a TCM practitioner and also a professor for TCM treatment. So, during the outbreak of the COVID-19, I led a TCM experts team heading to Wuhan for the treatment in the Leishenshan Hospital and the 5th award of the infectious department of the Leishenshan Hospital. I also come from Hubei, so I speak the local language. I think my past experience helps me to participate in the standard making of the treatment of COVID-19 in the TCM part. So today, I think I have a lot to share with you in the TCM treatment in COVID-19.
所以在目前没有西药特效药治疗新冠病毒肺炎的情况下，中医药具有特殊的一个治疗地位。今天我就想把我学习中医有关治疗传染病，以及在临床中运用中医药中西结合治疗新冠病毒的肺炎的体会和大家分享。
Since up to now, there is no knock-on drug in the Western medicine, so I want to talk about the TCM treatment, traditional Chinese medicine's treatment in COVID-19. I think from the TCM histories and philosophies, we have a lot of literatures talking about how to treat infectious disease. And today I'm going to share you my practical experiences.
首先，我想谈一谈中医学对于传染病的认识，以及在我们防治新冠病毒肺炎当中的一些启发和运用。
So first, I'd like to talk about our understanding of the infectious disease in TCM and what TCM has inspired us in the prevention and control of COVID-19.
中国医学对传染病的认识可以追溯到殷商时代的甲骨文时期。
So I think the Chinese understanding to an infectious disease can trace back to over 2,500 years ago when China was still in the Yin and Shang dynasty.
我们中医的同行可以说对大家非常熟悉的有一本著作《黄帝内经》。《黄帝内经》在《素问·次发论篇》有一句话：“不向软者，正气沉内。”血不可干，就是说我们自身的免疫力增强，可能不会或少得传染病。
So in one of the TCM classics, Yellow Emperor's classic of internal medicine, there is a saying quoting the uprightness exists in your heart, so the toxicity won't disturb you and then you won't get infected. That is to say, to interpret into the modern medicine's language, that is to say, if you enhance your immunity, you are being your immunity will help you to ward off the disease and virus.
我们如果反过来理解，如果这个病毒的致病能力超过了人体的自身的免疫能力，也就是中医的正气受到了破坏，那么就会得传染病。所以我认为在传染病的阶段，我们认为它是有免疫力低下，也就是中医正气不足的一种情况。
So if we put it in the language of the modern medicine so far, if the virus load is surpassing the level of the your immune system that can handle, it is going to affect you. And the your immunity system is referred to the uprightness here, and the lowering down or weakening of your immune system is definitely going to be vulnerable in front of the virus.
所以我在后面还要讲的，对于新冠病毒肺炎的治疗，我提出了一个理论，就是整个治疗阶段都要注意患者的免疫能力，也就是中医的要提高他的正气，要补虚。
So for the treatment of COVID-19, I have put up a theory that during the whole course of the treatment, we believe the immunity is very important and it's actually at the core of our treatment. Throughout the disease, we should look at the immunity of the patient and also try our best to give more nutrients to the patient and enhance the immunity of the patient.
第二点，我给大家推荐一本著作，就是早在中国的明朝的末年，1642年，有一个著名的传染病学家吴又信，他著述了中国第一部传染病的专著《瘟疫论》。
Second, I want to recommend to you an ancient Chinese classic for you to read, that is The Plague Theory, which was written in 1642 at the Ming Dynasty.
他认为欲者感天地之利气，他就是说传染病是不同于其他的一些原因，像受寒、受热这些外部原因导致的疾病，它是天地之间，也就是自然界的一种具有传播能力的一种致病因素。
In this classic, it noted that thyroid does not infect people, epidemic can infect people. That is to say, epidemic or infectious disease is not what we have experienced like any other different categories of the disease. It is not because the environment is too hot or too cold. The epidemic disease is being spread by one material between the heaven and the ground.
并且他还指出了，无论老少强弱，诸致疾病，血从口鼻而入。他就指出了传染病，他对无论是老人还是小孩，还是身体强壮还是虚弱，只要接触了这种病毒就会发病，并且它的发病的途径是从口、从鼻、从呼吸道、消化道而传播。这是最早有史记载传染病传播途径的著作，比西方要早几百年，可以说是开现代传染病医学之先河。
So it also knows the infectious disease can affect basically everybody, no matter you are old or young, no matter you are strong or weak. And the infectious disease is actually comes or spread by the mouth or nose. So this is the first time in the history of the medicine, one philosopher or one medical doctor noted about the very natures of the infectious disease.
并且他进一步指出了，学之所着，有天授，有传染，虽感虽属，则病，其病则医的论述。也就是说，传染病它有通过天授，天授就像在于我们现在的气溶胶通过空气传播，有传染就是接触。这个认识也为未来我们中医采取香囊一些芳香类的药物进行气味消毒、空气消毒开创了理论依据，也为未来的空气消毒开了先河。
So it also noted that in the book of the plague theories, there are two ways to spread the plague, through the natural environment and through contact with the patient. They spread in different ways, but they are infected with the same toxicity. So I believe that this is pointing out our directions treating the infectious disease. We should, so back in the Ming Dynasty, many people used the disinfectant with aromas to eliminate the virus.
并且他还指出了食以感酒而发，这个就是非常相似于我们现代医学指出的传染病，有传染有潜伏期这个阶段一样的。这次新冠病毒的肺炎大多是到3到7天，和我们历史上的记载是一致的。
And in this book, it also noted that it took some time for the plague to come on after it had been infected with. That is to say, after you get infected with the disease or the virus, after the incubation period, you are going to show the symptoms.
由此可见，中国历史上曾经发生5000多次的传染病流行，没有摧垮中华民族。在现代医学没有介入的历史长河中，不仅能够治疗慢性病，更能够治疗包括重大传染病在内的危急重症，可以说是现代传染病学之先河。
That is the reason why the Chinese nation and Chinese population, after over 5,000 times of the outbreak of the infectious disease, we still survive today. And I believe that TCM can not only helping us to treat some of the chronic disease, it is also very helpful in treating the infectious disease.
第二点，大家觉得目前 WHO 认为，对于特效药我们不能传都过做，我们目前需要的要做的就是要进行有效的防护或治疗，所以我们目前在没有西药特效药的情况下，中医的治疗包括我们的防护都非常重要。中医学在这方面积累了丰富的经验，具有重要的指导作用。
So according to the latest WHO standard, there is no knock-on drugs for the COVID-19. That is to say, the prevention and control of the virus and also the treatment is very important. So that is the reason why the traditional Chinese medicine stands out during the outbreak of COVID-19?
有很多同行在我以前讲过，包括今天还有问，在目前流行的情况下怎么来防护。首先我们大家来学习一下《黄帝内经·寿文篇》里有一句话，圣人不知医病之未病，就是要我们在传染病流行阶段，包括其他的重大疾病阶段，我们要做好防护是非常重要的，要做到治未病，在未病先防的这个理念。
Some of my friends ask me, what can we do in front of this unknown virus and unknown disease? I want to answer them quoting the Yellow Emperor's classic of internal medicine, saying that scent prevent disease rather than cure disease. That is to say, the prevention and control of infectious disease is a very important and vital step.
举例说明，在防护方面要做好个人的防护。我们的古人还以无忧信来说，他就指出了把病人的衣服放到蒸笼，过去的中国人做饭用的一种蒸馒头的蒸笼，来把患者的衣服去蒸，进行消毒，为未来我们的高温消毒也开了先火，所以非常注意这些方面。
So we also talk about the personal protection or the personal hygiene. So you look at the ancient book and here introduced Mr. Wu Youke, saying like we should steam the closest of the infected family members on a steamer. I believe that is also the very early practice. For now, we also like use really high temperature to do the hygiene or do the cleaning of patients' clothes.
同时又非常注重药物的预防。我们现在消毒剂常用的就是含氯的或酒精制剂。吴有信指出，在传染病的季节，它可以用芳香类的一些中草药，像苍术。我们现在还用青蒿、薄荷叶、紫苏叶，还有这一类的叶来进芳香类的药物进行焚烧，也能达到一定的这个消毒、空气消毒作用。同时，我们他还主张用大蒜来进行预防。这是一种中医药食同源的一种治疗方法。
So we also talk about like how TCM or especially the Chinese drugs can be more like a preventive purpose. So right now we do a lot of like we clean the air, we do more to prevent the aerosol infection. So right now we'll use a lot of these disinfectant tools with the chlorine contained, and here you also can see in the ancient Chinese book we also have more or less the similar logic, and we also talk about that we can treat a patient or do more prevention job not only through medicine but also can do through the food, like we here talk about chew garlic in mouth.
还有更有趣的，有一个在我们中国有一本书是禁书，是一个史书的。在近代，过去传染病，我们过去大家知道中国是一个封建王朝。如果一个臣子家有3个人得了传染病，他100天之内不得入宫见皇帝，说明在中国很早都实行传染病的一种隔离防治的方法。
And we here also would like to share with you an old practice that is also back to the ancient time, because that China is still a feudal society. So we talk about if a member or like right now here we talk about the government officials, or for the old days the officials work for the empire. If like 3 family members all infected with the plague, and then that person was should not allowed to go to the empire house to meet the empire. That basically, if you put into today's context, which means quarantine at home.
由此可见，我们中医学无论是在理论体系还是在防治体系上，都在几百年前得到了建立，并沿用至今，一直有效地指导现代的临床防治。
So if we look back to the historical practice, no matter is for the theories or the practice, that actually also reflect the truth or work effectively even under today's pandemic.
接下来我和大家谈一谈有关在中医理论指导下的新冠肺炎的中西结合治疗的策略和个人的一些经验的分享。
And second, I also would like to share with you the practice and the strategies of COVID-19 treated by the Chinese medicine and Western medicine together.
首先，我在前面讲的就是要扶正。我们现代医学西医也认为，早期的免疫治疗、全程的免疫治疗，对提高机体的免疫力、促进疾病的恢复、阻止恶化，具有非常重要的作用。
So first of all, I would like to mention is one of the most important points that we should strengthen the healthy qi or the vital qi inside the body, because that healthy qi means immunity. So throughout the whole course of the treatment, we emphasize a lot, both from the Chinese side and also the Western medicine side, we should strengthen the patient's immunity, which also can help the patient recover faster.
所以临床上我基本上常用的是黄芪、西洋参、太子参、灵芝，还有一些补气的药物进行早期的治疗，还有太子参都取得非常好的一些效果。
So if you ask me like what kind of the medicines I give to the patients, I use a lot of medicines like ginseng or the Radic ginseng that really help the anything that can help the patients restore or improve their healthy qi, I will use them.
第二点，中医非常强调对传染病的一个排毒疗法。过去的排毒主要有呕吐、泻下，还有发汗、利小便这些途径。
So second, we talk about one of the very important methods practiced under the TCM is detoxing. Basically, it's like we would like to get all the toxic out of the patient's body, either through the let them sweat a lot or have more pee, or that we talk about diarrhea, and also the other way of detoxification.
这个就是无忧性的瘟疫论，他就提出了对于瘟疫要早攻早下，全程首尾要以通下为治疗的一个体系。在临床中，首推中药大黄，我在临床中也取得了非常好的效果。
So we talk about, here you can see the book I mentioned many times is the plague theory, and here you talk about is the method of the deification or the detoxing should practice as early as possible, and that should be started from day one and should continue to the end of the disease. And I use a lot of the medicines, the Chinese medicines like Da Huang to help me.
大黄现代研究的作用，第一个有抗炎、抗病毒的作用，改善微循环，改善肠内膜屏障及肠微生态，防治胃肠功能衰竭，对肝肾功能有保护作用，类似于我们就是中药治疗的一些肝肾功能不全的一些现代的血液净化的作用，对多脏器功能衰竭有非常好的一些疗效。
So here I also list some of the benefits brought by the usage of the rhubarb. So first is the anti-inflammatory and antiviral effect, and second is improving macrocirculation, and third improving intestinal mucosal barrier, intestinal microecology, and also preventing the gastrointestinal failure. And also fourth, here I listed is preventing liver and kidney damage, and also multiple organ failure.
大黄也被收录于英国的药典。我们一般来讲，用生大黄最好。这个对于腹泻的病人用熟大黄。一般的剂量在轻症用个10克，对于肺炎或重症的患者用到20或60克，取得了一定的效果。
So here you talk about the treatment experience. For my practice, we normally give a raw rhubarb powder with water to the patients. For mild symptoms, that's around 10 grams each day, and for severe or critical condition patients, that's can up to 20 to 50 or 60 grams each time. And also you can hear that the Da Huang or the raw rhubarb also recognized by the British side. So we talk about it, the raw rhubarb that's for the mild symptom patients, and also for some of the patients, it's better to use the cooked one.
第三个，要注重中西结合专方专药的运用，受葛洪青蒿榨汁之列举。大家知道，中国有一个诺贝尔奖的获得者屠呦呦先生，就是激起了近代葛洪的青蒿榨之列的一种思想，发明了青蒿素。我根据自身近20多年来运用中药治疗病毒性肺炎的一些经验，治疗新冠，给大家推荐2种药，一个是虎杖，一个是马鞭草，对消化道病毒、呼吸道病毒都取得了比较好的临床效果。
So also addition to my practice, and also I also am inspired by Tu Youyou. Tu Youyou is a very renowned Nobel winner, and also she invented or she found the artemisinin, that the anti-malaria drug. So here you can see also bring it to us a juice. So we also recommend 2 Chinese medicine also listed here. That's in Chinese name Hu Zhang and Ma Bian Cao. And also good to treat the novel coronavirus patient.
所以基于上面我给大家的介绍，我想说明一点，中医不仅仅强调辨证论治，也强调以现代疾病以病名为疾病为主的一种辨病论治。我们要筛选具有抗病毒、新冠病毒的中药，也是一种非常好的策略。
So under the background of there is no magic bullet right now available, so we talk about the TCM, actually not only for the syndrome differentiation. Actually, you also can see TCM can do a good job in diagnosis of syndromes and diseases. So we believe TCM can play its role, and also that should leverage the TCM's role to treat coronavirus patients.
大家知道，新冠病毒肺炎一个是从呼吸道，一个是从消化道传播。有些病人表现以呼吸道的发热、咳嗽为主，有的病人不发热、不咳嗽，表现为发力、腹泻的一些临床表现。而马鞭草和虎杖同时具备有抗呼吸道病毒和消化道病毒的作用，同时还兼有护肝的一些作用，对肝功能损害具有良好的治疗作用。
So we talk about the COVID-19 virus actually impacts in 2 ways. Some of the patients actually they have the syndrome like the fever, cough, and some patients actually did not really have the fever or coughing, but they actually is like diarrhea or fatigue, lack of strength. So you can tell actually COVID-19 virus impacts the respiratory tract or the digestive tract. So here, as I just mentioned, the 2 Chinese medicine, the Hu Zhang and Ma Bian Cao, they have really good effects in not only the respiratory tract and also the digestive tract.
最后，我和大家谈一谈血液净化在新冠肺炎中的应用。刚才我在前面也讲了大黄就有类似于血液净化的一些作用，在清除炎性介质，还有防治类毒素这个清除类毒素或炎性介质方面具有非常好的一些临床效果。
So here I also would like to share with you the COVID-19 blood purification treatment. And I just mentioned one of the Chinese medicine is called the Da Huang or the rhubarb. Actually, rhubarb can play a key role here in eliminating inflammatory media. And you can see at least here is have a good job to kill the IL-1 or IL-6, and also can do a good job to improve the immune system.
大家知道新冠肺炎 它叫肺炎，但是我们在临床上发现，它要比一般的肺炎要严重得多，它会导致全身性的器官功能衰竭。它既具备 SARS 病毒的特点，又具备艾滋病的特点，对人体的免疫具有强烈的一种破坏作用。
So we talk about COVID-19 virus. It is a pneumonia, but it's actually more contagious. You can see actually it has the feature of SARS and also the HIV/AIDS, because we can see it can lead multi-organ failure. So we talk about we need to think about how we can really deal with disease from multiple angles.
我们知道，严重的危重症患者，或者是头轻症普通性加重的患者，都存在一个问题，那么就是体内的炎性介质，就是细胞因子的免疫失控，也叫这个炎症细胞因子风暴。这一点可能是公认的一个问题。但是血液净化，包括中药的这个就是大黄这一类泻下的药物，具有这些免疫调节作用，阻止炎性风暴的一些作用。
We all know that for the COVID-19 patient, no matter for the severe or critical patient or the mild patient who are getting worse, they are all experiencing one phase of the disease, that is the cytokine storms. I believe the rhubarb, among other different TCMs, has a really good efficacy in treating the cytokine storms.
再一个，血液净化还有对肝功能损害、肾功能损害具有良好的支持作用，对类毒素有清除作用。我们的中药大黄也具备这些作用，所以在很多方面，我也非常支持一个就是一些血液净化的治疗。我们有时呼吸机的运用，包括 ECMO 的运用，我觉得在早期的血液净化更有效的能改变患者的预后。
One important feature of the COVID-19 is the hepatic failure and even the renal failure. So that is to say, the COVID-19 can effectively affect the systems, and it really being affected by the endotoxin. So I believe the late-stage ECMO and ventilators is also work as the same principle just as the rubbers, the TCM medicine. So it helps us in the process of the blood purification.
所以在中国国家卫生与健康委员会修订的第7版的诊疗方案当中，就明确指出，血液净化可以清除炎性介质，阻断细胞因子风暴，减轻脏器功能损害，主张用于重症、危重症患者的早期治疗。如果缺乏血液净化这些治疗措施，中医的大黄可以尽早的进行干预，不失为一种有效的一些方法。
So in the 7th edition of the guideline for NHC of the novel coronavirus diagnosis and treatment, it noted that blood purification can prevent inflammatory mediators and block cytokine storm. And it also helps to reduce damage of the inflammatory response to the body. It can also be used in the early treatment of the cytokine storms and also in severe and critical patients. So I believe the TCM herbs, just like the rhubarb, among other different TCM herbs, can effectively block the cytokine storm.
顺便给同行汇报一下我们在雷神山工作期间的一些情况。我们病区收治病人114人，出院107人，纯中医治疗70人。
So I will also want to share with you the data that we have got in the Leishenshan hospital during the outbreak of the COVID-19. In my ward, I'm responsible for 140 patients, among which 170 of them were discharged from hospital and 70 of the patients received pure TCM treatment.
没有一例患者死亡，我们的药费基本上是7000多一点人民币。我们的抗生素在全院所有病区使用最低，收治病人、出院病人32个病区处于第1位。
So I think among all of the patients, there is no reported single death that I was in charge. Among 17,000 patients in Leishenshan Hospital, we are the only medical wards use the limited amount of the antibiotics, and we have actually have the best treatment qualities compared with other different medical wards.
我们的治疗原则就是中医为主，中西医结合。
Our treatment principle is the TCM at the core, while we also use the assistant help, combining the TCM and Western medicine.
对于轻症、普通性肺炎的患者，纯中医治疗；对危重症患者，采用中西医结合、中药加气管支持治疗为主的中西医结合治疗的方式。这也是我们成功的经验之所在。
Our successful experience is that for the mild patient who suffered from ordinary pneumonia, we give them the TCM treatment. For the severe and even critical patient, we provided them oxygen support among TCM treatment, and that is my experience.
最后给大家介绍一下针灸一些治疗功法的一些治疗。在雷神山医院，我们得做一个调查，基本所有的病人都具有焦虑的状况。中医药在干涉病人的焦虑，尤其是针灸、抗焦虑治疗方面，调节机体的免疫，具有非常好的一些临床效果。
So I think in the treatment of the TCM, finally, what I want to share you is the practice of the acupunctures. I believe that acupuncture not only serves as a very important medical treatment, it is also serves a very important way for our psychological support. We all know that for the COVID-19 patients, there are many of them suffered from anxiety. So we provided them a lot of the acupunctures to treat their anxiety.
我们运用中医的针灸功法治疗，还有中医传统音乐治疗，彻底改变了患者的这些不良情绪，在提高免疫取得了很好的效果，在雷神山大多数病区得到推广应用。因为时间关系，我的讲课就讲到这里，我们随后开始互动。
So we are using the TCM treatment together with the Kung Fu's in the TCM practice and also the TCM psychological intervention therapies and classical music as a very good intervention measures to serve the patient in their meditations. And I think this is also very important assistant ways to treat the patient. That ends and concludes my introduction part. Thank you very much.
Okay, thank you very much, Dr. Fang. 谢谢方教授。那我们下面要听塔图里医生，他还要跟我们分享一个 PPT. So let's we know that Dr. Tatuli also has a presentation to share with us. So would you like to go ahead, Dr. Tatuli?
Good day, everyone. I would like to introduce myself first. My name is Thomas Tatuli, and I am an emergency doctor in Western medicine, as well as a TCM practitioner and head of the TCM department in Alice Hospital.
大家晚上好。首先，我想要对我自己进行一个自我介绍。我是 Tatuli， 我医生，我呢是在我们医院的急诊科工作。一方面呢，我有一定的西医背景，同时呢，我现在也是一个中医药的医生。
I would like to present to you what we have done in TCM in France during COVID pandemic.
我想要跟大家分享的是，在法国我们如何用中医药来治愈新冠肺炎的。
To briefly start, I'd like to precise that there are two in-hospital departments that are existing in France. One is in Alès and the other one is in Metz. There is also TCM center in Paris attached to the La Pitié-Salpêtrière Hospital.
那首先的话，我想要介绍的是，在法国的话，我们一共有3个不同的中医中心，一个是在艾斯利，另外一个是在威利斯，还有一个呢是在巴黎。我们也有一个中医药的医院。
Because we had a very large amount of ill people at the same time, we decided to focus the treatment in Western medicine for COVID patients, but decided to focus TCM for healthcare workers to make them go through this difficult situation the better.
因为新冠肺炎的发生比较突然，当时有大量的病人涌入医院，我们当时呢就采取了这样一种措施和一种决定，就是说我们呢对大部分的病人都是采取西医的治疗方式，但是呢对于大部分的医护人员，我们都会给予一些中医的诊疗，来辅助他们更进一步的增强免疫力，促进他们在整个的新冠肺炎的大爆发的过程之中增强免疫力，避免感染。
So I will present to you what we've done in ALS and MES. In ALS, we've made around 650 consultations in 6 weeks, and we have seen around 50% of all employees in the hospital. And in MES, they have done around 1,000 consultations in 4 weeks, and they have seen around 20% of all employees.
那我想介绍一下我们在ALS 和MES 两个不同的城市中心所做的一个内容。在 ALS 的话，我们其在6周的时间之内提供了650次中医问诊，那是覆盖了大概15%的医疗人员。那在 MES 的话，我们是在4周之内提供了1000次中医问诊，覆盖了20%的医护人员。
We're now undergoing studies to describe all the pathologic troubles of the patients. But I can say that we've treated physical and psychological pain, sleep disorders, digestive disorders, stress, anxiety, fear, exhaustion. We also have make proposal for alternative to non-steroid anti-inflammatory for, like example, migraine or inflammatory diseases, and also prevention of the COVID disease.
那其实我们现在呢，也是有一些针对新冠肺炎的一定的现在正在进行的研究。我们的研究覆盖如下方面，其中包括有肢体的疼痛和心理的疼痛、睡眠不充分和睡眠的一些不充足，病人的一些消化不良问题，病人的压力、恐惧还有病人的焦虑问题，以及病人的这个体力不支问题。同时呢，我们也对这个新冠肺炎的预防做出了一定的研究。我们还去针对了新冠肺炎的一些症状，比如说这个偏头痛和病人的一些免疫反馈类的疾病，做出了一些诊疗。
To make so, we have used all TCM tools like acupuncture, herbs, Trina, Qigong, cups, nutrition, and so on.
我们其实是应用了所有的中医方法来做一个综合性的治疗。我们其实是用了推拿、气功、针灸、中医营养学等等不同的中医的分支来支持我们的整个中医诊疗。
All the healthcare workers were very pleased and with the TCM treatments, and this news spreads inside France. So several other hospitals started to include TCM to treat healthcare workers, like in Paris, in Givors, and Saint-Laurent-du-Var.
在法国的话，目前为止，我们对于整个中医药诊疗的结果是比较正面的。所以说，我们现在有越来越多的一些医院正在使用中医药来帮助他们医院的医护人员在新冠肺炎大爆发的时期提高免疫力。同时呢，也去对于新冠肺炎感染的医护人员进行一定的诊疗。这个中医药的这个诊疗方法呢，现在在巴黎、在格尔索、在圣罗普索渐渐的流行起来。
There was also help from the out-of-hospital TCM practitioner with an NGO called Eliscare. We created Care4Med to help health workers to go through the crisis.
那同时呢，我们也为接受新冠肺炎中医药诊疗的这样一些病人提供独特的医疗诊疗卡，也跟一些非政府的组织机构合作希望他们呢能够为这样的一个医护人员提供中医诊疗的一个快速通道。
We did also had a few treatments for COVID patients, especially in MES hospital. I asked Dr. Tomasini, who gave the authorization to speak about.
我们确实也用中医药对新冠肺炎的病人进行了一定的诊疗。我们在这个 Mass 的这家医院里面，有很多在这个 ICU 里面有很多的一个中医药的应用。那接下来的话，我可能会让 Dr. Thomas 给大家一个更详细的关于在 ICU 里中医药的一个介绍。
Dr. Tomasini is a critical care doctor and also TCM practitioner and the head of the TCM department in Metz Hospital. As working at the critical care doctor, he used acupuncture to treat 36 patients. These patients were classified according to the clinical classification of TCM COVID pandemic in critical case. They were having mechanical ventilation as well as other assistances.
那 Dr. Thomas 呢，他是在 Metz 医院里的一个重症医生。他在他的整个ICU 的病房里面呢，针对36个病人实施了中医药的治疗，其中包括有针灸、推拿等等不同的一些中医药的诊疗方法。所有的这些病人呢，都属于危重症病人。
He used acupuncture principally to treat the toxic heat he found inside the patients and also to relieve fever, and as very good result, like the temperature going to 40 degrees to 37 degrees in an hour only with acupuncture treatment.
他呢用针灸去驱除病人身体内的邪毒和热毒，同时呢，针灸只应用在体温发烧处于37摄氏度到40摄氏度的这样一个重症病人的区间之内。
He's right now doing studies, but the follow-up is a bit complicated because Metz Hospital had to transfer a lot of intubated patients to other French hospital resuscitation area.
他现在呢正在进行一个更大规模的这样一个临床的实践过程，但是呢也遭遇了一些临床上的困难，因为 Metz 医院必须要把自己现在的一些新冠肺炎的病人去转移到其他的一些法国医院。
There was also help from the outside of hospital from TCM practitioner. They created the teleconsultation platform to treat with herbs 108 patients.
我还听说呢，有一些中医药的专家通过远程诊疗的方式为108名病人提供了中医药诊疗。
I thank you for listening the presentation and ready to answer any questions.
非常感谢大家的倾听，我现在也已经准备好回答问题了，谢谢。
Thank you very much, Dr. Tatuli. That's given us a good overview of the use of TCM in China and in France. So let's open up the floor to some questions. 那我们现在可以进入这个互动环节。我先邀请我们的海外嘉宾来提问。So Dr. Laura Ciminelli, perhaps you'd like to go first with a question or share any thoughts?
Okay. Hello, everybody. Thank you for this good chance to meet Professor Fang and talk about the situation. Unfortunately, in Italy, we had a large number of deaths. Also, this is caused because the first level doctors, in Italy we have a family doctor, which is the doctor when people get sick. They first of all they contact with this basic level physician, and but these doctors now complain they didn't have any kind of medicine any kind of prevention or to cure the confirmed cases and the mild symptoms. So this is very bad because it means many of them get evolve towards severe or critical cases. We did our best. We are an institution of traditional Chinese medicine, working in Rome, Italy, many years, and we did our best to let the people know the possibility of a therapy with Chinese medical herbs. Unfortunately, our medical system maybe is much not very open, and the medical doctors now are looking for the family doctors now are complaining, and many people and many doctors are looking for new methods. Natural methods, and so because of this, the Chinese experience would be very important. And also, I like to ask Professor Fang, which is the vision of a traditional Chinese medicine about vaccine, because here in Italy, many people fear that in autumn we will have another stronger attack of COVID-19, and some people would like to take a vaccine, but many other people think vaccine is not very good because it could weaken immune system, which is the Chinese traditional medicine view.
你好，我来自于意大利。我首先呢，非常感谢大家给我这个机会。那现在呢，在意大利的情况呢，其实是非常不理想的，因为我们可以看到意大利现在死于新冠肺炎的人数是逐步在上升的，而且这个数量是非常大的。那在意大利有这样的一个现象呢，是首先如果这个人感觉不舒服的话，他首先会联系他的家庭医生。但是家庭医生其实来讲的话呢，在这样一个非常时期，他们也很困难，他们经常抱怨说，没有人跟我们说怎么去应对新冠肺炎，我们没有药，或者我们没有任何预防的措施，或者是我们不知道怎么去治疗它。所以可以看到的这样的一个结果是什么呢？就是有很多轻症的患者，可能是因为这样的一个情形之下，使他们的病情的耽误了，所以很快从轻症演变成了重症。那我想来讲的话呢，作为我们医院，我们是这个从事中医的医院。那我们现在在罗马，我们医院来讲的话呢，也是一直致力于学习发展和拓宽传统的中医药文化。但是毕竟在意大利来讲的话，现在可选择的中医药还没有那么多，所以呢，我们也非常感谢今天给我们提供这个机会，能更多学习中方的经验，因为我们知道中国的经验对于我们来讲的话是至关重要的。那我想问一个问题，我的问题呢其实是和疫苗有关，因为很多人都在猜测说8月份的时候，新冠肺炎可能会再次强势卷土重来，所以我们想问的是，疫苗可能是解决整个这样一新冠肺炎最好的办法，因为它可以让整个这样一个肺炎的毒性会下降。那但是疫苗来讲的话呢，可不可能会对人体的这个免疫系统造成危害？那有没有这样的一种可能，就是中医药能在这方面发挥它的作用？因为我们知道中医药其实对于提升人的这样的一个身体免疫力是有非常强的这样一个功效的，您怎么看？
谢谢。我想呢，就是在前面我也讲了，中医药提倡的是治胃病，提倡的提高人体的正气，提高抗病能力。
First of all, thank you for asking this question. the philosophy behind the TCM is we want to strengthen people's vital qi, which is actually their internal immunity, and that can help them to eliminate pathogen. So we talk about TCM, the role it can play is help people to defend themselves from invented by the infection, the virus.
正如 WHO 所讲，这个就是目前不要对这个疫苗或特效药过于更高的希望，关键的问题就是在防范或治疗这些方面下功夫。我完全同意这个观点。目前疫苗任何一个国家的官方没有正式发布疫苗的消息，对于它的安全性，这个在临床应用的一些有效性还有待于进一步去证实，这有一个过程。第二个呢，在没有西药或特效药这个就是疫苗的情况下，中医药就是一个不失为一个很好的一个方法，能够在很短的时间内通过对疾病的分析，对病人本身或不同地区国家的一些情况的分析，能够立出一条方案，是一个非常适时的一种特殊的一种治疗方法，是非常可行的。
So first of all, I would like to say that the statement from WHO is that we should not give really high hope to vaccines because right now we don't know the safety of the vaccines, and also the clinical efficacy of vaccines also need further approval. So there's no really sound base for us to trust any vaccine right now because they're only in pipeline for further approval, and that also take time. So we need to do is we need to shift our focus to more how we can better prevent and treat our patients. And we then come to TCM, the role of TCM, because right now there's no effective or specific medicine to cure COVID-19. Then TCM may can play its role because we know TCM actually can give a different thing based on different syndrome. TCM actually can come with different formula or medicine based on different countries' condition, and also can give a medicine based on different patient situation.
再从国外的一些同行的一些探讨，还有有关的一些媒体报道来看，目前在国外轻症的，包括普通肺炎的病人，大多都在居家治疗。在这个阶段，我曾经在上面也前面讲过，中医药对于这一类的治疗是非常有效果，纯中医就能够达到很好的效果。第二点，能够有效的阻止轻症普通性肺炎向恶性病变、向危重病的发展，在这些方面已经有非常好的临床研究证据。
And based on my discussion, also the communication with our colleague overseas, and also based on the media coverage, we can see majority of the patients in their mild or normal symptoms actually right now still stay at home for treatment. Then here is what TCM can do. Actually, we can give a full play to TCM. That's maybe also can 100% rely on Chinese medicine, because Chinese medicine actually can effectively help the patient from preventing them worsening from mild symptom to severe symptom. Actually, we have a sound clinical evidence to prove at this front.
主要的一些中医的方法，一个就是要中医长期讲的要安神定志。中医有一句话去讲的：恬淡虚无，真气从之，病安曾来。我在前面也讲过，我们有些病人吃不好，睡不着，严重的影响了患者的一些免疫能力。这个我们通过中医的功法或针灸的一些治疗，可以对高危人群进行干预，对有防护条件的同时，可以对病人进行干预。
So if we talk about a way of TCM practice, first of all, we need to calm the nerve of our patients, because we talk about right now, we see the anxiety actually quite common among the patients, even they stay at home. So we talk about actually they cannot really eat, cannot really sleep. This really impact their immune system. So we talk about either through the acupuncture or from the very traditional normal practice of TCM can really help this group of susceptible population.
对于轻症的病人，我们可以通过一些简单的中药，因为在国外中药的一些治疗方法，包括一些药物受到限制。关系中医很多药物是药食同源，比如说对轻症西洋参、黄芪、太子参，还有这个灵芝，甚至灵芝孢子粉这一类的药物，在国外应该有。早期的进行干预对轻症是有效的。对于普通性肺炎，我主张的刚才在前面讲的有几味药，一个是大黄，可以用10到15克，如果有腹泻的病人可以用炙大黄，用西洋参、人参可以用到就是15到20克，包括西洋参或人参。麦冬可以用到30克，因为这类的病人大多数出现咳嗽、少痰，这个就是没有痰的情况，能够用中医的一些仪器养阴的方法能起到效果。同时有针对马鞭草、虎杖这一类的药，如果有的话加上去，有一定的抗病毒作用，能起到非常好的一些疗效。
And we talk about for the mild symptom patients, we know actually the TCM not fully opened in the overseas market, so we not really have a handful of choices here. So we talk about that you can use the Western ginseng or the Chinese ginseng as a good choices, and also you can go to the medicine I mentioned at my opening, the introduction, the rubber. Actually, rubber is really good. The raw rubber can give to the mild symptom patients at around 10 to 15 grams per dose. And for the patients with diarrhea, then you need to go with the cooked rhubarb. And for the ginseng or Western ginseng, you can go with the dosage of 15 to 20 grams. So we talk about the patients, and you also can give the other two, the TCM, that's the Huzhang and Ma Biancao, as I introduced in my PowerPoint.
如果有中成药，像莲花清瘟胶囊，它里面也有大黄。如果出现发热、咳嗽或肺炎表现的，也可以运用。对于危重病医院的危重病患者，我建议有多脏衰或其他的呼吸衰竭一些情况，危重情况可以用人参或大黄，一般在30克左右，包括人参或大黄都能取得很好的效果。一个是提高免疫，第二个能够起到对炎性介质的清除、类毒素的清除，防治多脏器功能衰竭是有非常好的。
Then we come to the severe condition patients. If you can get access to Lianhua Qingwen capsule or HHQW granule, then it's good, because that LHQW granule that also include the medicine as mentioned, that's the dahuang or the rubber. And also because right now we can see that the patient admitted to the hospital may have the multi-organ failure or respiratory failure, then you can give the dahuang plus ginseng. So together you can give the dosage at around 30 grams that can help the patient to improve their immune system and also lower the inflammatory, and also help to lower the cytokine storm.
同时我再三强调一点呢，就是危重病人患者多发生在具有并发症，你像有高血压、肥胖也是一个非常高危的因素，还有心脏病、糖尿病、免疫性疾病这些疾病，这一类的人群平常要注意加强个人的自身防护，一个少出门， 做好洗手、戴口罩、不聚集这些方面应该注意，同时保证合理的休息、饮食，还有良好的心理状态，尽量做到不发病、不感染，视为上策。
So we talk about the patients, especially those with multi-underlying disease like hypertension, obesity, or the other very frequent thing, the underlying disease. Then my suggestion is like they should protect themselves even better. So please pay more attention to their hand hygiene, always wear masks, and also sleep well and eat well. I believe that's also one more thing I would like to mention is not to really go to the population gathering places. Avoid mass population places.
All right. Well, thank you very much. 谢谢方教授. Let's bring in Dr. Regis. Thank you so much for patiently waiting. 那我们下面请这个海金斯医生来跟我们分享. Go ahead with any question you may have or anything you want to share with us.
Okay, thank you very much. First, I'd like to thanks for the invitation to be part here. As you might know, here in Brazil now, we are facing a very serious situation related to COVID-19, the increasing number of cases and the increasing number of deaths. So my question is basically related to Chinese medicine. As there are more and more evidence related to the blood problems related to COVID-19, and in Chinese medicine, there are some very famous and important formulas to activate blood and transform stasis. So I'd like to ask Professor Fang if were this kind of formula considered and which suggestions he can give based on this matter of activating blood and transforming stasis. I understand he already talked about Dahuang, but there are some other famous formula. So I'd like his opinion on that. And another thing is, as you might know, outside China, most people, when they think about Chinese medicine, mostly they are talking about acupuncture and moxibustion. So is it possible to comment on the strategies of easy treatments that could be recommended for associating the treatments of acupuncture and moxibustion for improving the health of patients, but also, as the friend from France mentioned, to treat those who are on frontline as well.
谢谢大家给予我这个机会，能够让我来这里问问题。我是一个巴西的医生。我们都知道，现在巴西新冠肺炎的情况呢比较严峻，死亡人数也是不断上升。所以我想问一下中医药的一些相关的药方，就像是这个方教授刚才提到过的一样，我们中医是有一个在这个血液方面的一个疗效，针对新冠肺炎的这样一个疗效。我是听说在中医有很多的药方能够进行活血去瘀，那我想问一下，有没有这样的一些药方能够在新冠肺炎的病人的诊疗过程之中帮助活血去瘀的这样一个过程？您刚才说了大黄，当然我也认为这是一种非常有效的中医药药草，但是呢，有没有其他的一些药方您可以介绍一下？第二个问题是，其实呢，在中国之外的一些国家，人们提到中医药的时候，第一个印象就是针灸和艾灸。所以我想问的是，有没有一些针灸和艾灸的方法，因为他们也是更容易被大众所接受的，来进一步的去提高人们身体的免疫力啊，包括针对病人的一些针灸和艾灸的治疗方法是什么呢？谢谢。
非常高兴问这些问题，因为巴西目前处于疫情的正中，所以我也经常看到一些消息，现在发病率非常高，死亡率也在攀升，所以给防控带来了非常大的一些问题。这个问题可能跟疾病的认识不足或政府的管控的这些方面是有一定的关系。
So I'm really honored to take your questions. I heard that Brazil is actually right now in the epicenter of COVID-19 with a rising number of the mortality ratios. I think it's because of the problems or unawareness in the prevention and control, or the government's effort in the prevention and control.
对于这个病是一个传染病，第一要预防， 预防的措施就是减少聚集，减少出门。第二个就是勤洗手、戴口罩，远离传播源。
So COVID-19 is an infectious disease. What we can do right now is only prevention and control. So we should stay at home, avoid densely populated areas, wash our hands often, and wear medical masks when we are on site.
中医药历来重视对传染病的预防。第一个，刚才我在前面讲了，对生活、对运动方式以外，也注重药物的预防。对于药物的预防，除了我刚才介绍的一些药物，包括中药的黄芪，还有美国、加拿大产的一些西洋参，中药的灵芝孢子粉是个成药，应该买得到，是吧？以及还有一些中药的一些灌种，也少量的灌种这一类的药，还有清热解毒的这些，就是金银花也有，尤其是在气候炎热的时候，有一定的疗效。
So of course, prevention and control in our day-to-day life is very important, but we should also use some of the TCM herbs. I mentioned a few, including the Da Huang, but I also want to highly recommend you the Huang Qi and ginseng produced American ginseng or Canadian ginseng. And one special formula I highly recommend you is also the Lingzhi Bozi formula. Among other different herbs, I highly recommend Guanzhong and also the Jinhua flower, which is also a very important anti-inflammatory TCM herb.
第二个问题就是一个我在前面讲到的，新冠病毒肺炎会出现凝血的问题，有些患者表现到四肢的紫绀，甚至中风。最近在德国的病例解剖发现，有10几个病人，其中有1/3有肺栓塞，就是凝血在患者的这个病情发生当中，包括婴幼儿所出现的掺气病，都是与凝血有关。所以冠状病毒导致的炎性介质的释放失控引起的炎症反应所导致的凝血功能障碍，是这个疾病发生的根本原因。
So for the COVID-19, we have seen many different coagulation dysfunctions, including the clot in the blood vessels, stroke, thrombosis in the lung part, and also recently I heard that in the child across the world, the Kawasaki disease is also widely distributed. I think behind all of these phenomena, we should look at its nature. It is because of the release of the pro-inflammatory factors into the body, affecting the normal functions of all the different organs and circulations.
我在武汉雷神山医院的时候，发现有类似这样的病人，他表现在四肢的紫绀、中风，病人的舌质出现紫暗。我用的中药除了大黄以外，还有虎杖本身也有活血的作用。同时还有一些药物，像益母草，我用的量比较大，用到60克甚至更多，能够起到活血祛湿的作用，对凝血障碍有非常好的效果。同时还有水蛭这个药物，它活血抗凝，它不至于引起凝血。我有一个老师，国医大师朱两春，生前有这个方面的经验，他传授给我。我取得非常好的一些疗效。中药还有一个药三七粉，对凝血机制的紊乱也非常有良好的效果，以及还有丹参，都可以在临床上加以运用。
So I have one clinical experience back in Wuhan. I found the patient suffered from the clot in the different extremes of his body, and the patient also suffered from stroke. So I think it's because of the dysfunctions in the blood activations. I highly suggest Dahuang, Hubiancao, and also and among other different drugs. I also use a heavy dose of all of these drugs. I also recommend the Shuizhi. It is a drug which is used in the blood activations and anticoagulations. This is a drug that my mentor taught me, and I found it is very useful in the clinical practice. And for the anticoagulation TCM herbs, I highly recommend the Sanqi and Danshen as one of the important pleas.
你的最后一个问题就是针灸在临床上能够在海外广泛接受，我们在这个方面是怎么运用的？我们在雷神山医院，我们90%的病人要接受了针灸治疗。这个治疗大家一定要注意，是在防护条件下去进行干预的。对于在国外，尤其在巴西这些人群，在没有防护的条件下，我建议不能直接进行针灸治疗。如果要进行针灸治疗，一定要加强防护。第二个，运用的针管要用套管针。
So your second question is about the usage of the acupunctures and also the tomopunctures. I think that in the back in Wuhan, I have used the acupuncture in 90% of my treatments. But when the doctors and medical workers is applying the acupunctures, you should be aware of the personal protections, because without a proper personal protections, I would not recommend my Brazilian colleague to use or direct contact with the patient of COVID-19. And I also believe that you should wear a full equipped PPEs, and the acupuncture needles you are using and applying should be acupuncture capsules with the needle inside. This is going to prevent you from the direct contact with the patient.
我们在雷神山医院曾经带了一个仪器，叫针灸经络诊断仪。我们通过仪器分析，发现病人的病变主要在手太阴肺经、足太阴脾经，找到了相关的穴位，足三里、肺腧穴还有太冲这些穴位，取得了比较好的效果。
So we have one equipment that we were applying in the Leishenshan hospital, which is TCM equipment, helping us to find different acupuncture channels and acupuncture points when we are applying them. And I believe that Tai Yin Fei Jing and Tai Yin Pi Jing are the two important channels that is similar to blood vessels in our body that you could apply to, and I think it's very effective when I applying these acupuncture needles to the certain different points.
我们同时还开展了针灸治疗新冠病人患者缺氧以及减少或替代呼吸机治疗的一些尝试性工作。这个工作我10几年前在上海就在开展。我们发现针灸能够显著地改善患者的缺氧状态。第二个，能够减少患者的人机对抗，还有脱机困难以及待机时间这些方面都有非常好的效果。给大家介绍一个穴位，就是膻中穴。膻中穴在胸口，膻中穴。
So in the applications of the TCM to the COVID-19 patient, I also find the acupuncturists do have very good efficacies in treating the hypoxemia, because I have done this research decades ago, and I found that acupuncturists do help the patient with the symptoms of the hypoxemia. And for those patients needs intubation or oxygen support, we can use the acupuncturists in all the process, including if the patient, we can actually ease the tense or pressure between the patient and also the intubation equipments, and we can also help the patient to better or faster recovered from the intubation process. I think this is one important important factor I want to mention about. Another important factor I want to mention about is actually that one medical point, that is the 膻中穴, which is on our chest. This is also a very important acupuncture point for us to apply.
针灸，
谢谢方教授。
针灸
先打因为时间关系，方教授不好意思，我们先打断您一下we're just going to take a pause there. We do actually have a question coming in from one of our viewers that we'd like to ask our doctors. 我们下面因为有一个网友的问题，想请教各位回答一下哈，方教授，所以打断您一下。No, let's take a look at the question. It's going to be coming up on the screen. So this question comes from Isaac Juma. I'm a community health volunteer. What's the first aid given to a person with COVID-19? 这个问题是在问网友是一个社区工作人员，想知道就是有没有什么急救方式，就是可以针对这个新冠病人的，有没有什么急救方面的建议。Now this question goes to all of our doctors, and of course any of you can jump in any time. 方教授，您看你有没有什么建议可以给的？
在这些方面呢，我今天还在谈这个问题。在新冠肺炎发生的时期，我们很多患者仍然会出现心脏呼吸骤停，而我们的有些人员见着以后，不但脱下口罩，直接进行这个人工呼吸，这个情况应该加以注意。
So I think that one thing we should notice during the outbreak of the COVID-19 is that there are still some of the patients suffered from the acute heart failure. And if you're seeing a patient clapping down, suffered from the acute heart failure, and when we are providing the respiratory assistance, we should be aware that we should not remove our medical masks.
对于怀疑心脏呼吸骤停的患者，首先还是不能脱下口罩。要进行有效的心脏按压，开放气道，把这个就是口对口的呼吸，这个要慎重，可以做一些腹部按压、抽筋、膈肌运动，增加腹压或胸压的一些方法来解决。及时联系相关的医疗机构，送赴就近的医疗机构进行救治，是最好的办法。
So for those who suffered from the acute heart failure, who might suffered from the acute heart failure, we should, as a rescuer or first aid provider, we should never remove our medical masks. We should open their airways and try our best to avoid mouth-to-mouth respiratory assistance. And we should also to try our best to press their diaphragms among other different muscles in their chest, and we should also to help them to restore their normal thrombotic pressure level.
Anything to add from Dr. Regis, Dr. Tatuli, or Dr. Giminelli on this question about first aid? 我们看一下其他的医生有没有什么可以要补充的。
Only one question is about the point Tanjung. Is it possible to stimulate with massage? It will be effective.
Sorry, Dr. Giminelli, we'll come back to your question perhaps later if we've got more time. I was seeing if there was anything to add to this viewer's question about first aid that can be given to COVID-19 patients. Is there anything that you have to say on that?
我可以说中文吗？
Of course.
就是想
Any first aid for COVID patients?
膻中这个穴位能不能用推拿方法来做推拿？
膻中穴，我们的经验主要是抽针的频次，抽针啊，如果这个就是推拿的方法，可能效果可能要差一点。再补充一点。 对于中国的中医的心肺复苏是非常有历史的。早在东汉末年1800年时候的张仲景就在运用。我给大家顺便推荐一个穴位，涌泉穴，也可以用在急救。涌泉穴离呼吸道很远，我们阿根廷有个学者叫阿准，是吧？曾经研究30年，觉得它是一个对人体类似于具有急救作用、心肺复苏作用的一个穴位。我们可以建议推荐它的使用，大家也可以上网会查得到有关的这方面的一些报道。
I think the very essence of the using of the Tanzhong point, Tanzhong Xue, is using the rough needles to frequently point at it, and the powers or the strength that we are using or applying at massage is not enough for us to treat the COVID-19 patient. In the TCM, we also have a quite long history of the CPR, and I also highly recommend another acupuncture point for you, that is Yongquan Xue, Yongquan point, which is also applied quite frequently in our clinical practice.
All right, thank you very much. 那方教授，您也有一个问题想问一下我们的外国医生哈。So Dr. Fang has some questions also for our doctors abroad too. 那方教授您请问。
我想呢，就是目前就是尤其是像意大利，我们目前的巴西这些高发病率的国家，对于目前的这普通型、轻症、重症或危重症的这些患者的一些比例及其死亡率是否和我们报道所看到的一致，尤其是死亡率的一些人群是哪一类的人群。
So I want to ask about the mortality ratios in Italy and Brazil. I found it very hard to believe the mortality number in Italy and Brazil. So that is the reason why I want to confirm here that is the number reported, is it true or not? The second question is that for the mild patient in Italy or Brazil, what kind of a medical treatment do you apply to them?
Perhaps Dr. Hedges can take this question.
Hi. Yeah, here in Brazil, yesterday it's confirmed that we have a total of 300,000 cases, and we just passed 20,000 deaths. And in different areas of Brazil, there are a little bit some different numbers. So, for example, here in São Paulo, where I live, in the city of São Paulo, the mortality rate is about 7.5%. And in Brazil, it's considered to be 6.5%, the mortality, the death rate right now. And basically, they are doing Western medicine treatment. There's no Chinese medicine treatment officially suggested. And there's no one rule of treatment. So different states of Brazil are presenting different treatments. So there's no one specific treatment for rule for all the country.
我先来说一下巴西的情况。巴西目前为止，就是截止到昨天的话，确诊病例是33万人，死亡病例是2万人左右。圣保罗市的死亡率呢，就是我所在的城市是7.5%，整个巴西全国的死亡率呢是6.5%。其实目前为止，在巴西我们主要应用的手段是西医的一些手段，我们在整个巴西国家也没有一个统一的诊疗方案，让整个全国的医生去应用。
All right, thank you very much, Dr. Hedges.
Thank you.
All right, let's go to Dr. Tatuli again. We'd love to hear from you a bit more. Is there anything further you'd like to share with us, or any more questions? 请我们的法国医生来跟我们分享一下。
Thank you very much. I have a question regarding bibliography. Even if in France, TCM started to implement itself, we still lack a lot of scientific articles on Western medicine point of view. And I would like to know if you plan to translate all the Chinese studies that are still in Chinese and that we like in English and publish in official internet like PubMed. And if it's possible to centralize them in the same place so we can find it easier.
你好，是这样的，我有一个问题是关于这样的一个中医药书籍方面的问题，因为我们看到，其实现在法国来讲的话呢，是很需要中医药方面的书，但是其实现在并没有翻译的版本。我们想问的是，我们是否有可能翻译和出版中医药治疗新冠肺炎，也特别是中国现在的这个研究方面的这些书籍？然后或者是说有没有可能，比如说把它们收集在一个集中的地方，这样的话呢，我们可以方便的去拿到这些书籍中的一些治疗的方法。
新冠肺炎的相关的这个理论研究著作，还有临床研究的一些文章也比较多，但是比较分散。有关防治方面的书，我是编写了第一部中国的中西结合新冠肺炎的防治手册，在今年的2月初就出版，其中也有相关的在一线的我们的一些经验，所以得到了就是推广。所以在武汉我们也运用取得很好的效果。最近我们编著了一个120例的一个临床验案，中西结合的验案也正在出版，月底就出版。同时其他这也是最早的一本临床验案的一个出版。同时一些文章我目前正在搜集，像刚才你讲的这些书目的英文的归类的这些书籍或相关的一些网站，目前还没有。我是世界中医药学会联合会急诊专业委员会的会长，所以也在经常跟海外包括美国、欧洲的其他国家的同行都在交流，也正在积极的推进这项工作。如果一旦我也现在正在着手把这个工作建好以后，如你需要我给推荐给你。
Thank you for asking this question. Actually, you mentioned about the books or the clinical study papers. Actually, there are a lot of them available, but unfortunately, they're not really gathered to either one place or a centralized platform. And I can share with you is that actually I compile and publish one book, and also that's the very first of its kind, related to COVID-19 cases. That is the COVID-19 treatment by combining TCM and Western Medicine. That's available to the public at the beginning of February, that book. And in that book, you can find actually that is Frontline experience accumulated and shared in that book. All the cases actually you can find had a really good result in Wuhan city. And also very soon you will see another book published available to the public. That's actually a 120 clinical cases that will be available very soon. And as you mentioned this question, I'm also the leader of the Chinese Medicine Association. So I had the communication with our overseas colleagues and practitioners. I really, right now, I can tell you, I work so hard to make this happen. If this is available, I will share with you ASAP.
Well, that's great news. Thank you very much. 谢谢方教授. We'll have to wrap up our discussion here. So I want to say a huge thank you to all of our doctors for taking the time out to participate, get involved, and to share your experience and your knowledge with us. And thank you very much to our interpreter as well. 十分感谢方教授与我们分享您的经验。那我们现在就在这里先暂时收场了。您给我们提供了一些很重要的信息，非常感谢。So it's been really interesting to hear this rather different approach to treating patients with COVID-19, and TCM, it's very ubiquitous and widely trusted here in China, but of course it's still somewhat unconventional abroad. So it'll be interesting to see how this goes and if this will become more widely used as a form of treatment. So we'll wrap it up here. This is COVID-19 Frontline. I'm Jiao Yang. Thanks so much for watching, and do keep an eye out on our CGTN platforms when the next session will be. Bye-bye.